There wasn't a space for women to be themselves in every facet of their lives. The Good Girl podcast was created to offer that space, to have conversations with a gutted truth without restriction. Join us to unpack your own set of questions and confessions in this good and safe space. My name is Cameo King. I am your host of the Good Girl podcast. I'm so excited to have you here. Excited to continue these conversations with experts in our community that care about us, that are walking hand in hand with us with the things that are most precious to us, right? Outside of our spirit, outside of our, who we are, outside of our character is our body, is our physical body and everything that comes with that, our mental health. So I'm excited to have a continued partner in this conversation. That's the Ingham County Health Department, and no stranger to the show, we have Dr. Shoyinka. Dr. Shoyinka, welcome back. I told you, I think you need your own mic. I think you need your own.
No, you're doing a good job. You're a good platform, so we're good. You're getting it out into the community. You know, your people are listening, so we are happy to partner with you. Thank you for using your platform to be a place where we can, amplify the important message that we have at the health department, and really is, to just let everybody know that our mission is to ensure that our community is healthy, and we continue to do whatever it is that we can with the resources that we have to make sure that we're delivering the best care within society and addressing those things that are getting in the way of every Ingham County resident living a healthy life.
Yeah. So thank you. It's always good to have a partner in the community that's really making strides and that's really excited to do something different. Right. And just paying attention, right? And really caring for their community in a very unique way. So I'm appreciative of the partnership as well. And if people don't know who you are, can you just give them a quick introduction, right? I know you, but I don't think I've ever given you the opportunity to say, this is who I am. So I'm gonna give that to you right now.
You never said that. So my name is Shoyinka. I am the medical director for the Ingham County Health Department. And that means that essentially I kind of say I'm like the doctor for the whole of Ingham County. Essentially, I actually cover another county too, which is Ionia too. So I'm the doctor for both counties. And when I say the doctor for them, that doesn't mean that I see every single person, but we make sure that we address the health needs of the community. So what are those things, those broad things that we do in society to, one, prevent disease, prevent illness, prevent death? And then how do we address those problems when they exactly, come to us? How do we treat them? COVID is a really good example. And then we also look at, from the back end to how can we do something so that something doesn't happen again? And that is a very broad way of explaining what happens at the health department, because it spans all sorts of things. It spans, communicable diseases. It expands, it covers environmental health. It, so many places. But I am infectious disease trained and also trained in preventive medicine. So I like to say that it gives me a unique perspective on public health overall. But as always, I'm always glad to be here.
Yeah, and I'm so glad that you shared that you have a background in infectious diseases, which came, I don't want to say came in handy during this time, because, I don't think you want that to come in handy. I don't.
Well, no better time than this, right? For you to have some of that insight relative to other things. So it came in handy, if that's not a wrong way to put it. Yeah. You're right.
And so I think this is the big question that a lot of us have. It just seems like the news may have shifted. Our attention may have shifted because of everything that's happening in the world, right? Yeah. There's a war happening.
I know.
But I think the question on a lot of people's minds, if they haven't already made the assumption and begin to transition that way, are we done? Like, can we wash our hands, pun intended, of COVID?
I like that. Wash your hands. No, the answer is no. But that doesn't mean that, we are certainly like today, somewhere in what's today? Today is like the 10th, right? Today is March 10th. Yeah. So around this time 2 years ago was when I think my March 12th or something was when we had the lockdown. Like, COVID was here in Michigan, and anyone who was around then, comparing, yes, that time to today, comparing that time to 2020 to 2021 to where we are in 2022, we can say that things are different. They are better. But we are not in a place where COVID is gone. Um, we had a lot of the Omicron variant over, Christmas through January. But we knew based on modeling and things like that, the epidemiological studies that we did to kind of see what this virus would look like, we knew it was going to surge. We had this big surge and then it came down crashing and our numbers are a lot lower. A lot of people, like, I feel like everybody, even people that I didn't know, that I knew before that had never had COVID, by January, everybody had ticked the box. And now it's kind of quiet. The other great thing is that when we know we have high numbers, we see things like, the hospitals are full, things like that. And all of those things have improved significantly, within a space of a few months. And as we continue to monitor our numbers, we continue to look at how that would look like going forward over time. And right now, based on that modeling, we're in what we like to call a recovery phase. So the health department, the Michigan Department of Health and Human Services, has kind of categorized this whole response cycle, so to speak. And right now we're in recovery from that surge that we experienced early on, right? Where numbers are low, we're watching, we don't necessarily have like a variant that is scaring us. There's, the Omicron, there's a variant that's like in the UK, but it hasn't really shown that it's not coming yet. It hasn't shown a lot of, I'd like to say, promise, so to speak. And so we're watching. But as a society, we can say, things are better. Kids are, in school. Some of the guidance, things like masking guidance and things like that, we've been able to relax on it because we can see that we're not in that emergency stage anymore. We have a good number of people who are vaccinated. We also have a good number of people who have already gotten the infection or something. And we also have this variant that we just experienced, which, was highly transmissible, but overall did not cause as severe disease. So we can see like the whole cycle of the pandemic itself. We're moving from, oh my God, everybody is dying, to a mild disease. We're also at this place where, oh my God, anybody who has it gets really, really sick. And a few people, not that many people are getting it we've come to a place where it's kind of spread through community. And we talk about how we were in a pandemic and now how we're moving to that endemic phase. Endemic meaning it's more common in community, but with less severe disease. It's more common. So I don't have a crystal ball, right, to say, no, this is the end. I hope so. I think as summer comes through and, we're able to move out more and do more outdoor activities and not be, inside where there's higher chance for transmission amongst people when people are sick, that will help overall in terms of, reducing things. But as we move into the fall, it'll be interesting to see. Hopefully there is no new variant. Those things are being watched very closely at multiple levels, all the way from, WHO, CDC, and every state level, and also, at the local level too, so that when anything does happen, like I said, we're in that recovery phase now, but if we start seeing things, then we can kind of shift our recommendations, our practices in terms of, right now we're saying, okay, the MDHHS and CDC has said, we don't have to wearing masks. The recommendations behind wearing masks has kind of changed a little bit, and it's not mandated anymore,
Mm-hmm.
though recommended. And so if we get to a pre-surge case situation where we see more virus showing up and our hospitals are getting full, and we can see what's happening in one state versus the other, then we can now say we're in a pre-surge, and if we see this happening based on the numbers and based on the modeling that we do, based on how well we see that the virus transmits, all of those things we put together epidemiologically to determine how soon our numbers will go up as we look at hospitalizations, death, number of cases, and then we start shifting in terms of the recommendations that we give in community. There's like, okay, sorry, we said you could ditch your mask. Well, we never said ditch your mask, but now you've got to wear your mask, or you've got to wear it in indoor places, and
Right.
those kind of things. So that's where we are in society now. I think public health is trying to make things easier on people. One, because there is not a lot relatively that is going on, and everybody's tired.
Yeah.
Um,
Yeah.
so that's kind of where we're at.
Yeah, and I appreciate that explanation, and again, really painting a clear picture and talking about how we got here, because I think there is a difference. If I'm hearing you correctly, there's a difference between the recovery phase and saying we're done with this thing.
Absolutely. Yeah. And it's kind of hard to say. I don't know I don't know that we will ever get to a place where we can say we are completely done with COVID. The anticipation is that COVID is going to be like another influenza eventually. So I don't think we kind of, I, I dare say we kind of lost the window where we might have been able to like completely get rid of it. But it won't be as threatening. It might just be another vaccine, maybe annually, and maybe not. I know that there's a lot underway in terms of research and development, looking at ways to make the vaccine more durable, so that it doesn't have to be so frequent. But the issue with that, like influenza, the problem with influenza and why we need it every year is because the strain changes every year. So they have
Mm-hmm.
to create a new vaccine every year. And so as long as we're not getting like, new variants and things like that, then we might be good, or we might be able to find that universal one that kind of covers potential variants. So that's yet to be seen.
And something else that you mentioned too, I like how you explained the model, right? That there is a model based on the research, based on now that the experts, the scientists, the researchers, the folks
Right.
that collect data, like now they actually have data to refer to, saying
Right.
this is the cycle of
This is how long it takes. This is on average. We can tell that, if things are going the way we see it, maybe our curve will be going up, or maybe it'll peak, and even give some kind of a good time frame to it.
And so I think one of the I don't know if one of the big questions, but it's essentially like, can we, summer is upon us, spring is upon us, can we really just like go party and let go? Like, can we relax? We've
I,
been,
you know, I think that's an individual decision. I think that's very, it's relative to, um, yeah, I guess the best way to say it is still individual. I
yeah,
mean, yeah, we want to party, we want to let our hair down, but then we have an individual, each person has the responsibility. If you're sick or you've been exposed to someone who was, and you should technically be, quarantining, or, you kind of feel funny, then it behoves you as an individual to make that decision where you go and who you interact with,
yeah,
considering the fact that if I go out and I've been coughing and sneezing and feeling kind of funny, then it's probably not right for me to go to a concert where we're going to be yelling and screaming. Though I have not been in a concert in, 3 years, whatever. And, I really want to go. But then that's, that's kind of like the difference. Again, when we talk about the phases that we've been in,
mm-hmm.
before, all of us in public health, we're saying, y'all need to stay home. Y'all need to wear your mask. Y'all need to, do everything, giving all those instructions. Now everyone should know what to do.
Yeah.
Right? You should know what to do. And so that decision is on you right now to keep yourself, your loved ones safe and not, make other people sick. And like I said, the good news about summer is that we get to do, as the weather warms up, we get to go outside more where there's more protection and, there's less chance of transmission overall. So nobody's saying don't party. We're just saying party wisely. I'm looking forward to summer, to, having opportunities to hang out with friends and family and, and do stuff. But I'm just going to have to make sure that I put all those things in consideration. Think about the people that you're going to see, especially the people in your life who are vulnerable, who have immunocompromised conditions. You want to really think about those people and think about how you interact with them. If you feel funny, don't be ashamed to wear your mask around those people or stay away, and then there's always going to be another day. Like, it's better to be in doubt and, just stay away than, to put someone at significant risk. If you're that risk can be so different when you have someone who has some kind of condition that affects their immune system where they can't really fight disease well. So you don't want to be responsible for that.
And with you sharing that, it makes me think about, your role in the community, your role with Ingham County Health Department. I think you've been privileged to see a lot of different sides of the world. And when I say that, how the community functions, what data we have, how doctors respond. Like you had that privilege to see that on a county-wide level, two counties now. And so my question is, what have you seen that may be nuanced or that you didn't expect, like in terms of community behavior? Because when you say that, it makes me think, and I would hope that we've learned a lot about our interactions that, and there's a lot of jokes out there, but, about washing your hands. Listen, I saw a quick, a Saturday Night Live sketch and they were talking about, people who wear masks and anti-vaxxers and people who, want to get the vaccine. And the lasting joke was, the CDC kind of, let go of some of the mandates. And one of the person's responses was like, well, I didn't wash my hands anyway. And it was like,
yep.
Come on. Like, yeah. And so I say all that to say, have you seen a change, anything like just new being birthed out of a community habits?
I think that's an interesting question. And I think that in terms of community habits, we do have a group of people, where as a society, we're kind of split. This really showed us how split we can be in terms of our beliefs, in terms of our concerns, what we understand. And so, seeing some of those societal changes are, it's interesting, but it really depends on, where you kind of fall on that spectrum in terms of what you believe and what you understand. I think, for example, that masks are never, ever, ever going away, in the sense that there will always be people who will be like, you know what, I'm just going to have an extra mask in my bag. You know what I mean? So I think that we're going to be, the threshold for grabbing a mask in the future, even after this is gone, I think it's going to be a lot lower, because before, we never did this, but this is something that has been happening in China and Japan for ages. Whenever they have like their flu season, everybody just dons their masks. So I think that that's something that some people will still continue to, or, at least let me have it as backup. I think that, and because of that, that also I think has given, even your joke about washing hands too. I think that has informed how we think about environmental cleaning. Even though, early on in the pandemic, we thought that, what we did with surfaces was really important with regards to COVID transmission, but later we found that it wasn't as important as, wearing your mask and that respiratory protection. But it still has informed how we do environmental cleaning, in public spaces, and how people think about what they, touch in public spaces. So I think that has given, we've been able to do some public awareness about infection control is something that I think just generally society probably has a better understanding of. But at the same time, then we also have the flip side where we have people who fortunately were not affected by it. And so therefore can say, I didn't wear my mask anyway, and I didn't wear my, and I didn't wash my hands anyway. So why should I bother? So there's that side to it. But I think it's changed the way we think about a lot. And I don't think that we haven't seen the end of it. Even within healthcare, the conversations about what to do with healthcare has definitely changed. If you think about what we do in terms of society, even just like working remote versus not working remote, should everybody go back to work, or should we have this hybrid model? There's just so much that has changed. So we can say, oh, the pandemic was bad. It also gave us ways to think about how to do things differently as society. Some good, some bad.
Yeah. And yeah, the COVID has really completely turned us upside down and around and made us really question some things. I would hope it has questioned some things about if what we're doing is really effective in every industry. And is it really people driven? Meaning, are we really putting people first? Or are we putting institutions first? Are we putting profits first? All these things. And so while COVID, unfortunately, was a deadly disease, I would hope it forced, the world and us on the Western side of the society to really examine ourselves and examine.
It has. Unfortunately, hopefully we'll be able to put some of those things into, like policy and create infrastructure around them. It has changed the way people, public health is viewed. It has brought a lot of attention to public health, some of which has been bad because we had public health as an institution had so much resistance in some ways. It also showed how poorly supported and funded our public health institutions were in terms of infrastructure. And I know I'm going into like policy stuff now, but all of those things are things that this, it just kind of, when you like duct tape something and then all of a sudden you need to carry a bag and put like 20 pounds in it. It's just like, oh, sorry, that, the handle just broke.
No, but it's funny. But no, it's important that I think that you went and you began to talk about policy, because I believe from our last conversation, I got a couple of DMs and one talked about, the health system's failure to own, their failures. And I think you did in the last conversation, like, no, there are definitely some areas where we could have done better.
Communication and stuff like that. Absolutely.
Yep.
So that's one piece of it. But then the other piece is that even from from that policy, from that support, institutional support, government support, there was, because things have gone well for so long, there wasn't a lot of backup. We'd kind of, as a society, they pulled resources that should have been stayed in public health to address other things. And so all of a sudden we started scrambling within the public health system. So some of that is public health's fault. Some of that is just not having the resources and being prepared. And we do a lot of like processes like emergency preparedness and things like that for when, bad things happen. But yeah, the pandemic was different. And despite all our preparation, there were some things that we were not prepared for.
So I'm thinking, so it's two questions that are essentially trying to come out at the same time. But one, I think about the long haulers, right? Those who contracted COVID and have the disease. and are still having issues breathing, like everything, headaches, walking, how
Right.
they taste food, brain fog, all these things. Has there been any, whether it's discoveries or innovation or just hope for those who are experiencing long haul symptoms?
So, I think that that whole syndrome is a little, and I think we talked about this a little bit the last time I was here. That whole syndrome is a little difficult to categorize, because what defines long haul syndrome, and what are the categories? Like, there are people who had COVID early on and have had symptoms for the last 2 years. There are people who, maybe they've had it for, they felt ill for a few months and then it went away, on its own. We do know that sometimes viruses, in disease generally, it not only affects you know, our bodies in terms of just causing inflammation, but that inflammation could also affect, our intrinsically affecting our immune system, intrinsically, or maybe it's like the chronic inflammation, maybe not chronic, but inflammation that happened during that infection. And because of the makeup of an individual's immune system, maybe they were not able to, ramp it down even after the virus, maybe it triggered something. There are all these theories out there as to why we have long haulers syndrome. And, there are other syndromes that kind of look like this that might not be originally as a result of an infection.
Mm-hmm.
One similar thing that comes to mind is like, what we commonly call chronic fatigue syndrome, right? And so when we think about syndromes like that, supportive care is what we do while we wait for our bodies, support our bodies to do the best that it can, support our bodies to be able to respond, to heal properly. And those are the kind of things that I've seen underway. Not that there's a pill, not that there's an injection to, get rid of long haulers, but the idea is, giving that support to the body to the point where our bodies have the space and are not fighting or whatever it is doing, causing all that fogging to recuperate finally. But some research might take a while, so I don't know that there's any clear answer for that yet. And I know I said that kind of like the last time too, but unfortunately,
It's the truth. It's the
yeah,
truth.
medical. I mean, we've done a lot though in medical care, in medicine and science generally. Usually, finding a cure for anything takes months, years actually, 5 years before something conclusively happens. So, considering when this started and where we're at now, in 2 years, we've got treatments, we've got that work well, that work really well. We've got vaccines. Medical practice, medical science, we've made progress, and I'm sure that with each passing day we'll get even more answers.
Yeah. So I feel like, again, I think a lot of folks feel like this, like we're on an uptick, right? I think I've heard some people call what we've experienced over the past 3 years a panorama with everything, with everything happening, right? I'm not just talking about COVID, but we had civil uprisings,
Yeah.
the transition of power. It was just a lot. I don't know how they're going to write this in the history books, right? It was just a lot, and cataloging a lot of conversations that were happening on social media and different platforms, but just a lot to take in. And it seems like
we're in this world now, sorry to interrupt you, but when you think about like world's occurrences, sentinel things that have happened, think about like, the World War II or whatever, think that we didn't have as much to document, to record all of that. So think about all of that now in the context of the way we have public opinion through social media, and then we have proper documentation and many more resources. It's just really interesting to see what this is going to look like, in 100 years. If
it is, and how do you represent all those perspectives with different that all mattered, right? And all who like may have shifted public opinion or whatever it is, or
Right.
influenced policy. But I say all that to say, it seems like I don't even want to say it seems like when there is a glimmer of hope, it seems like the rug just gets snatched from us. And
Ukraine and Russia.
right. Gas prices, $12 a gallon. I mean, I don't, and so just being honest about where we are, because honestly, in the back of my mind, it's like, we're going to see this again. The question is when, right? Is it possible that there could be a resurgence and we're all back in the same place in a year?
Again, no crystal ball here, but just understanding the course of a particular disease entity, of an infectious agent, and how it works through society. Unless, we develop like some really bad variant that, comes up and is very different and is, makes more people sick and things like that. But just seeing how this has cooled down over time. Yes, more transmissible, but less severe disease in the last wave. I'm hopeful. Let me put it that way. That's the best I can say.
Okay. All right. Well, Dr. Shoyinka, I thank you as always for being a guest on the Good Girl podcast. You always bring, I feel like you give us not only answers and responses, but you put it in context. It's never like a simple yes, no. Let me show you why and how we're here, and I appreciate that.
I appreciate being here, and I appreciate all your listeners.
All right. Well, thank you.
Good to see you. Bye-bye.
Bye.